Equipments. Okay, so far SRS and SRT, we use different types of equipments for different source of radiations. Among that, the first one is the gamma knife. Okay, so which uses 192 to 201 beams of focused gamma rays, all aiming at the tumor target. Okay, so this is ideally suitable for treating small or medium size intracranial lesions. Okay, so the first one is the stereotactic radiosurgery, the gamma rays. This surgery involves 4 phases. One is the placement of the head frame, and the next one is the imaging of the tumor location, and the computerized dose planning and control, and finally the radiation delivery. Okay, so the first one will be the head frame. Now we will see a video on that head frame, how the frame will be fixed. And next is the how the imaging, okay, of the tumor location based on MRI or CT scan will be done, and the dosage planning that we have seen in the previous class, the table of different organs and how to choose the dosage level. Okay, so based on a research article we have seen that. And finally the radiation, how the radiation is being delivered to the spot. Okay, so these are the things we will observe. So this video will show us how the gamma knife treatment has been done. Okay.
The gamma knife, also called stereotactic radiosurgery, is a type of radiation treatment used commonly for brain tumors. It may also be used for other abnormal conditions of the head. The gamma knife is a non-invasive surgical procedure that doesn't require incisions, which are cuts through the skin. Instead, a machine precisely focuses and delivers about 200 beams of radiation onto a target area inside the head. The radiation only kills abnormal cells, while sparing the normal tissue around them. The gamma knife treats small brain tumors, blood vessel malformations, and nerve conditions that are hard to reach or too risky to treat in other ways. The gamma knife head frame has 4 pins or screws. After numbing the scalp, the doctor will attach the head frame with the screws. The frame prevents the head movement and helps guide the radiation beams. With the head frame in place, an imaging study, such as an MRI or CT scan, will be done to determine the exact size, shape, and location of the target to treat. The treatment team will use the imaging studies and advanced software to create a treatment plan. Then, the patient will lie down on the gamma knife couch. A radiation helmet will be positioned over the head frame. The helmet contains holes that allow only the programmed radiation from the treatment plan to pass through. With the helmet in place, the couch will slide into the radiation unit. The procedure is silent and painless. It takes a few minutes to an hour or more, depending on the size and shape of the treatment area. The effects on the tumor occur over a period of time after the procedure.
Not being familiar with the course of treatment they need to undergo can be a frightening prospect. This video will guide you on what you as a patient can expect during the gamma knife treatment process. Following a referral from your general practitioner or specialist, you will consult with a neurosurgeon or oncologist who will assess your condition and determine whether gamma knife radiosurgery would be the best treatment option for you. If you are identified as a suitable candidate, you will be offered the next available appointment at the Gamma Knife SA Centre, situated at Netcare Moorpark Hospital in Johannesburg, in order to undergo treatment. You will be supported throughout your treatment by members of the multidisciplinary Gamma Knife treatment team. Upon your arrival at the Gamma Knife SA Centre, the treatment team will explain the procedure to you, and you will be offered a sedative to help you relax. You will be taken to the procedure room, where either the radiation oncologist or the neurosurgeon will place a metal frame onto your head and secure it by means of 4 pins, a few millimeters into your scalp. To make the procedure as comfortable as possible for you, a local anesthetic will be injected into the areas where the pins will secure the frame to your head. Once the frame has been fitted, you will be ready for detailed imaging studies, done through an MRI scan and in some cases also a CT scan. A member of the Gamma Knife SA team will escort you to the radiology unit where the scans will be done. Even if you have had an MRI or CT scan before, it must be repeated with the frame in place in order to precisely define the exact location, size and shape of the area to be treated. Once the imaging has been completed, you will be taken back to the Gamma Knife SA Centre to relax while the radiation oncologist, neurosurgeon and physicist design your customized treatment plan using the data from the imaging scans. This process can take up to 2 hours. Once all 3 of them have signed off on the treatment plan, the Gamma Knife radiosurgery can commence. Depending on your specific condition, you may be fitted with a special mask, which is molded to your face instead of the frame. The frame or mask ensures that the area to be treated can be targeted accurately. No general anesthesia is required for the treatment. You will be taken into the treatment room and asked to lie on your back on the Gamma Knife table. The frame on your head or mask will then be attached to the treatment couch. Once the table has been adjusted to a position most comfortable for you, it will slide into the Gamma Knife dome. The treatment team will leave the room to start the radiosurgery and will be managing your treatment from the adjacent room. You will remain in full view of the radiation oncologist, neurosurgeon and physicist via 2 CCTV monitors for the duration of the treatment.
Okay, that is a video on how the treatment has been given using the gamma knife. As we see in the video. Okay, as we seen in the video, there is 4 steps in the stereotactic radiosurgery. The first one is the placement of the head frame, that you have seen that they have screwed it. Okay, and anesthesia was given at the place where the frame is attached. And the next is the imaging method. Either we go for an MRI or CT scan to understand the actual location and size of the tumor. So next one is based on the size and location of the tumor. The dose planning is to be computerized. Okay. After that, the radiation delivery will be done. In that video, the radiation delivery equipment, that is a gamma knife equipment, was the new one. Okay, where additional masks are not required. Okay, that is the equipment. But there are gamma knife equipment where we can see that there is a placement of cover, head cover. In that head cover, there will be a lot of holes. Through that holes, the radiations will pass on to the patient. Okay. So this is the gamma knife equipment. Okay, which uses a focused 200 tiny beams of radiation gamma rays towards the tumor region. You can see that how the patient is fitted with that head as a alignment, and you can see that each beam has a pass on to the tissue. Okay. The advantages of the gamma knife radiosurgery is the first one is the precision. Okay, the precision. And the next one is the duration of the treatment. Okay, as you say that this can be asked in a 2-mark question. Okay, what are the advantages of gamma knife radiosurgery? Okay, the first one comes into important one is the precision. Okay, the exact precision can be achieved so that the healthy tissues will not be affected by this. Okay, so that is the main aspect. And the second one is the duration. Okay, so the duration of the treatment. Okay, so you can see that it is done in a single day. Okay, so that is the main advantages of this one.